Let us study about the radioulnar joints. The radius and the ulna of the forearm form two joints respectively at the superior end and the inferior, which are called as superior radioulnar joint and the inferior radioulnar joint. The bones have an intraosseous membrane between them, which is fibrous in nature, which is also called as fibrous joint or middle radioulnar joint. Now coming to the superior radioulnar joint, the type, it is a pivot type of synovial joint. When we look at its articular surfaces, the one of the articular surfaces is the head of the radius, and the other one is the fibroosseous ring formed by the radial notch on the ulna and the annular ring. The ligaments of the superior radioulnar joint is one is the annular ring and one more is quadrate ligament. Synovial membrane of this forms the synovial fluid. The relations when we look at, there are two relations anteriorly and laterally we can see the supinator muscle, and posteriorly we can see the anconeus muscle. The blood supply to this is supplied by the atrial anastomosis on the lateral side of the elbow joint, and nerve supply is by the musculocutaneous, median, radial and the ulnar nerves. The movements when we look at the superior radioulnar joint, it forms only two movements or one set of movements, that is one is supination and pronation. Looking at the inferior radioulnar joint, this is also synovial joint of pivot variety. The articular surfaces when we look at it, one is the convex head of the ulna and the its reciprocal notch, that is the ulnar notch on the radius. Ligaments when we see, there are two ligaments again, one is the joint capsule and the other one is articular disc. Articular disc is also called as a triangular ligament that's whose base is attached on the radius and its apex is on the ulna. Relations when we look at it, looking at the relations of the inferior radioulnar joint, on the anterior side we will get to see the flexor digitorum profundus muscles, the tendons of the muscle, and on the posterior aspect we can see the extensor digiti minimi. The movements of the inferior radioulnar joint is one again supination and pronation. Now the middle radioulnar joint or the fibrous joint, it is a fibrous sheet that connects the radius and the ulna, and this forms the syndesmosis type of the fibrous joint. Looking at the relations of the middle radioulnar joint, anteriorly anterior intraosseous artery and intraosseous nerve, posteriorly posterior intraosseous artery in the upper 2/3, anterior intraosseous artery in the lower 1/3 and posterior intraosseous nerve can be seen. Now looking at the movements provided by the radioulnar joint, it provides mainly one set of movements, that is supination and pronation. This is the supination. Looking at the muscles that provide this movement, there are mainly two muscles that help in the movement. One is biceps brachii. This muscle helps in supination of the forearm when the elbow is flexed, and the other muscle is the supinator. The pronation. Looking at the muscles that help in pronation, one is the pronator teres and the other one is pronator quadratus. The muscle brachioradialis helps in both supination and pronation as it brings back the forearm to mid-prone position.